People know dealing with diabetes doesn't just take a toll on your body, it also affects your emotions and even your family.
In today's medical moment, I had a chance to talk with a woman about how her battle against the disease has changed over the years. Now, Spectrum Health Medical Group has helped her along the way. This is Ann. She's diabetic, type 1. Been dealing with the highs and lows for a long time, and sadly, the lows are sometimes more memorable than the highs.
When I was diagnosed in 78, I was in the hospital for 10 days. They didn't really know what to do with me, so they come in every so often and shoot me up with insulin. And I was sitting in bed, and all of a sudden I started to sweat. And I thought, boy, is this, wow. And I said, I'm going away. And I went like this. The nurses are in there like, what do we do with her? So they fed me probably a couple gallons, I'm exaggerating, I do that, a couple gallons of orange juice, and then they went away and left me.
In the past, there was not a consistent way to dose insulin or treat blood sugars, and so what happened is, as people's blood sugars, when they came into the hospital, tended to bounce around a lot. It would go from very high to very low, and just like she said, they would have to drink a lot of orange juice to get their blood sugar back up. That would make the blood sugar go up higher. They'd get a dose of insulin. That would make the blood sugar go low again. So we always joke and call that the diabetes roller coaster. And so what we've done is we've developed insulin dosing protocols that stop that bouncing. When patients get their blood sugar checked here, they get it checked a minimum of 5 times a day. And all of that data is then stored in the computer system, and then later on we can go back and look at all that data, and then we can see trends and patterns and see, you know, where are the high blood sugars happening, where are the low blood sugars happening, what's the target that we want to keep these in, and then we can adjust our processes and methods to control that and get it down.
I dial 2 to see that I'm getting a nice flow, which I did.
But it's not just the technical aspects. It can be the little things that really help a patient deal with diabetes day in and day out.
What's the main thing you've learned from the people here? What have they changed the most for you?
I feel more comfortable that I'm being cared for, and they know what they're doing. And I see Dr. Deines, he's my buddy, my friend. You know, and I say I'm having trouble. I call him up and he'll say, come on in.
On top of their one-on-one relationship with the doctor, a patient can also rely on a panel of experts in things like pharmacy, nutrition, nursing, and diabetes education.
So we take care of them when they come in, during their stay here, and then have a plan for them once they leave here, because once they leave here, they're still going to have diabetes and they still have to deal with it. So we want to make sure that once you leave here that the system still takes care of you and that there's something in place, because, you know, we see people who travel great distances to get here, and so we want to make sure that when they go back to their community that there's good communication with their healthcare team in their community, and they understand what we did and why we were doing it.
And don't forget, you can check out all of our medical moments. Just go to fox17online.com and click on the news link.
And much more to come in our next